Hey, future RNs. So today we're going to talk about best practices when it comes to studying during nursing school and maybe later on when you're a lifelong learner. So number 1, group study. Number 2, practice questions. And number 3, flashcards. Stay tuned and we'll talk a little bit more about these.
Hey, yo, Renaissance, we the best. We the
Okay, well, welcome back. So we're going to talk a little bit more about some of our best practices when it comes to studying. Let's start off with talking about group studying, because I know, guaranteed, many of you are going to say, I can't study in a group. I think I was one of them. But let me tell you the benefits of studying in a group. You get to exchange ideas, you get to demystify ideas that were not necessarily clear when it was your teacher, when it was your faculty member, when it was your clinical instructor. It just wasn't that clear. You read the book, you did the question, and you're still not nailing it consistently. Sometimes hearing it from your peers helps. Sometimes teaching it back to your peers helps. And any combination of that is going to be helpful to you ultimately. But here's some things that you want to do to make sure that you're making the best and getting the most out of your group studying. First things first, be super selective about who you choose to study with. I've been known very often to tell students, you're probably not in the right study group. And it doesn't always sit well with everyone else, but please understand this. If you have bad study habits and then you join a study group with people who also have bad study habits, what does that even look like? So, segue to, if you select the right study group for you, you may have either different learning styles or similar learning styles that may either complement or diminish what you're trying to do. So you want to also make sure that as you select these members, you assign them specific roles. Not necessarily you, but somebody has to do it. You have to decide what each person is going to be responsible for when you meet as a group. Because here's the thing with nursing school, you don't have a lot of time. You want to make sure that because this time is super valuable, when you sit with your group, you want to make sure that you stay focused on what you need to get done. Okay, so you have to make sure that it's assigned. If you schedule a group study after class for 1 hour every time you meet, then you want to make sure that you have decided with the group what you will be doing and everyone comes prepared. If someone comes and they become dead weight in the group study, then they just need to not come to the group session anymore, because your time is super valuable. The other thing you want to do is, as you're giving the assignments, make sure that the goals of the study session are very clear to everyone. What do I mean by very clear? If you have 1 hour, you need to decide what is important for us to cover today. A good way to start off with that is to either look at your previous performance on an exam, previous performance in another class, look at concepts that as you were doing your reading, this was not quite hitting home with you, or just ask your faculty, what are some of the common hotspots that students tend to struggle with? Those are the things you want to cover when you're with the group, because you get to hear new perspectives. You're not just left to what you understand from your reading or what you understood from class. So best practice number 2, use flashcards. Okay, some people hate writing. Well, here's the beauty of flashcards. They're supposed to be brief. You shouldn't be writing long paragraphs anyway. But what I encourage you to do when it comes to your flashcards is have different flashcards with different purposes. So you may have a set of flashcards or a deck of flashcards that are solely dedicated to terminology, or solely dedicated to disease pathophysiology. Okay, and so you have a deck for that. You have a deck for words, or you might even have a set of flashcards that are just for normal or abnormal vital signs, normal or not normal lab values, specific to different age groups. Okay, so you want to make sure that you have specific flashcards that serve specific purposes, and quiz yourselves using those flashcards. When you go to your groups, quiz your group using those flashcards. You can exchange your flashcards. You could assign someone in the group to create the flashcards, and you're welcome to change them a little bit while you're doing your individual study. The other thing too is to make those flashcards work for you. So apart from it being brief, if you're a visual learner, then make flashcards that really focus on a diagram or a picture. Okay, it may be colorful, but I've seen where color can be overwhelming for students right before an exam. So they make these really pretty flashcards, or they have flashcards with lots of highlights in different colors, and it's overwhelming. It's too much stimulation right before the exam. They feel bombarded with all that stimulation. So you have to decide what it's for. You might even have a set of flashcards that are just for morning of exam, the things that you have to prep or practice just a little bit more right before your exam. But the important thing is be very aware of your learning style and be very aware of what your needs are when you're studying, and then the needs of your group when you're studying in a group. So best practice number 3, you want to do practice questions. Practice questions are something you want to start doing. You're going to increase the number of practice questions you're doing as you go along your program. And the closer you get to preparing for the boards, you really only need to be doing practice questions. But here's where you want to start. You want to start practice questions as soon as possible in your process. What does that mean? Don't start practice questions after you've covered the topic in class. You want to do your practice questions before. That way, you have an understanding before you show up to class or before you show up to your study group, what it is that you need from this class, what it is that you need from this study session. You have your baseline and you know where your areas of opportunity and weakness already exist before you show up. And you can specifically gravitate or design your study sessions to focus on those specific needs. Another thing you want to be cautious of when you're practicing questions is you don't want to practice a question with the intention to memorize. Don't memorize questions and answer options. There are a multitude of ways that the same question can be asked and a multitude of ways that the answers could be presented. If you get caught just memorizing, you're going to struggle when you're in the exam situation. So try to get understanding. Use every question that you do as a patient experience. That's usually what the difference is between you and your nursing faculty is, that they probably have a little bit more nursing experience than you do. And if you want to develop more nursing experience in the absence of actual patients, then meet patients through your practice questions. And remember what happened then and why it happened and why you had to choose this action versus that action. So learn from your questions. Call them patient encounters. The other thing you want to do is to make sure that you're using reliable sources for questions. There's lots of sources and resources available with questions and question banks and answers to these questions. Make sure they're reliable because you cannot always vouch for the answers and whether they are supported by the evidence. Remember, NCLEX relies on your understanding that this is not real life, but in fact is what would happen in an ideal life, in an ivory tower kind of setting. So be very careful. And if you're looking at a question and maybe there's a typographical error, maybe there is a misquote, and it doesn't ring home with true with what you've been reading in every other textbook, on every other resource, then you want to go back and check that answer against the reliable resource. The other thing you want to do is, I always warn students, don't show up to an exam where the first time you're being tested is this exam. What does that mean? At some point, you got to switch that practice question from practice to exam mode. You want to practice in real testing conditions where you're not getting instant gratification, where you click on an answer and the answer is generated immediately telling you whether you're wrong or right. Get used to that situation where you don't know what you did right or wrong until it's all over. Sometimes it's just that anxiety that messes us up during exams because you're not accustomed to just not knowing. right? So always try to, at some point before your exam, whether it is the NCLEX or whether it is your classroom exam, you want to make sure that sometime before that exam, you have tested yourself truly under exam or testing conditions. Quiet place, no phones, no resources. Just do those practice questions, even if it's only 10 of them. Measure your ability to sit through the 10. If you're expecting a 50 item exam, maybe find a 50 item test and do that before you show up. As you're reviewing your answers from your practice questions, don't ignore the questions you got right, because most of us will review the ones we got wrong, because we tell ourselves that's the one I didn't understand. But I want you to take it a step further. Review the ones you got right also, because sometimes you got it right, but for all the wrong reasons. And it's really important that you catch this before you go to an exam. Here's your bonus. Number 4, if you don't have a study plan that's a smart study plan, then you are definitely doing all of this wrong. What's a smart study plan? It has to be a plan that is very specific to your needs. It is measurable, so you gotta be able to itemize on that plan what you're trying to achieve with every study session. And it has to be realistic and applicable to you. If you are trying to cover 3 hardcore concepts in 1 hour that you have decided are very weak areas for you, then that's not very realistic, just for example. And you want to be time bound. So you want to know how much time you're dedicating. I've met students who keep studying and oh my God, I've been studying or I've been reading or practicing questions for 8 hours today. That's a full work day, and that's fine. But if you're not able to measure what it is you actually achieved and whether or not it's what you set out to achieve, then you'll always be anxious because you don't have a plan that you can measure that it's working. The reality is, if you fail to plan, then you've planned to fail. So hey, future RNs, if you found this content helpful or think it could be helpful to someone else, please don't hesitate to like, share, and subscribe. Bye.